What's the big deal about HIV and AIDS?
I thought AIDS was something for other people to worry about. Gay people, drug users, people who sleep around. We need to take the threat of HIV seriously.
You mean the virus that causes AIDS?
My friend, just protect yourself. Get the facts, follow advice, and know how to avoid becoming infected.
Is this a problem for young people as well?
Oh yes, HIV is a big problem for young people as well as adults.
You are joking. How many young people are infected with HIV in the UK?
I am serious. It is estimated that in 2007 there were 2 million people under 15 living with HIV, and globally AIDS is the second most common cause of death among 20 to 24-year-olds.
What's the difference between HIV and AIDS?
HIV stands for the Human Immune Deficiency Virus, and AIDS stands for Acquired Immune Deficiency Syndrome.
So HIV is the virus that causes AIDS?
AIDS is a serious condition which destroys the body's immune system against illnesses. That means people with AIDS can get many different kinds of diseases, which a healthy person's body would normally fight off quite easily.
How is HIV acquired?
HIV is passed on in sexual fluids and blood through unprotected sex with an infected person, sharing needles with. People can also become infected by being born to a mother who has HIV, and a very small number of people become infected by having medical treatment using infected blood transfusions.
Can you acquire HIV through physical contact?
HIV cannot be acquired by kissing, hugging, or shaking hands with an infected person. It's not even transmitted by sneezing, touching door handles, or sharing eating utensils.
Can you tell someone else is infected with HIV?
No, the only way you can tell is by taking blood tests. There are many persons who are carrying this virus and do not know they have it.
How long does it take for a person to acquire HIV?
It is estimated that it takes 3 to 6 months for the virus to incubate and then become detectable.
How long does it take for HIV to cause AIDS?
It depends on a lot of different things, from the time of being infected with HIV and being diagnosed with AIDS. These days, there are many drugs that can be used to help people with HIV, and most doctors believe that a lot of people can be treated for a very long time. Many people do not know exactly when they were infected with HIV, and the length of time between this happening and then being diagnosed with AIDS can be very variable.
How can you prevent becoming infected with HIV?
You cannot entirely prevent becoming infected, but you can reduce the chances of being infected by using the ABC methods as follows. A. Abstinence, meaning refrain from sexual intercourse. B. Being faithful to one partner. And C. Condom use.
What are the dangers of using drugs and alcohol?
Drinking and taking drugs gives you a false sense of security, and this may lead to risky sexual behaviour. The only way to be safe around drugs is not to take them. If you take drugs or alcohol, you might find it more difficult to use a condom, or you might forget altogether. If you are high on alcohol or drugs, you might not always know what you are doing, or you might not remember or care about the consequences.
Can someone get infected for the first time exposure?
Yes. If the HIV enters your body system by either unprotected sex, sharing a needle for injected drugs with an infected person, receiving a blood transfusion from an infected person, or being born to a mother who is infected with HIV, then you can become infected.
How can I tell someone is infected with HIV?
There is no way to tell just by looking at someone whether they are infected with HIV. Someone can be infected but have no symptoms and still look perfectly healthy. They might also feel perfectly healthy and not know that they are infected. The only way to know if someone's infected is to take a blood test.
How can I get tested?
If you are concerned about yourself, it is advisable to talk to a parent or guardian, school nurse or teacher who may direct you to a clinic where you can take a test. The clinic will suggest that you wait 3 months after your last risky sexual contact before having a test. This is because the virus is difficult to detect immediately after infection.
Will the clinic staff tell my parents?
The clinics in different places have different policies. Most but not all clinics have confidentiality policy and will not tell anyone without your permission.
How is the blood test done?
The clinic takes a sample of blood from you to examine. If you also want to be tested for sexual transmitted diseases or infections, the staff may take a urine sample. Some places can give you results on the same day. In other places, you may have to wait for a week or more. While you wait, you shouldn't have any sexual contact with anyone.
What if I have HIV? What should I do?
This can be a very difficult situation to deal with if your blood tests show you're HIV positive. You need to tell your parents or someone you trust to give you emotional support. You will need to tell the person whom you had had sex with and anyone you have shared needles with so that they can decide if they want to have a test. Your doctor at the clinic will give you more advice about how to stay healthy. They'll also be able to tell you if you need to have any other blood tests done and talk to you about medication.
Is there a cure for HIV and AIDS?
There is no cure for HIV, but if detected early, it can be controlled. There are several forms of medication which can be used to stop HIV developing to AIDS. These are called antiretroviral ARVs drugs.